I see you're doing tobacco. It's bad for you, you know. You should really quit that.
Is that so? I didn't know it was bad for me. Why should I quit?
Well, I'll tell you. In song. Dun-dun-dun-dun-dun. When... Oh. Tobacco use is the most preventable cause of premature death in the United States, according to the American Heart Association. Tobacco users are more likely to develop various vascular ailments, including atherosclerosis, which can lead to heart attack, stroke, and of course death. You can modify or control 7 major independent risk factors for coronary heart disease. 1. Tobacco use. 2. High blood cholesterol. And don't feel bad, I love pizza too. 3. High blood pressure. 4. Physical inactivity. 5. Being overweight or obese. 6. Having diabetes. 7. Having a healthy diet. Tobacco use by itself increases the risk of coronary heart disease. When it acts with the other factors, it greatly increases the risk from those factors too, thus making that pizza twice as deadly. Tobacco use makes you tire out more quickly, and it also makes your blood sticky. It decreases HDL, or good cholesterol. If you have a family history of heart disease, then your risk increases exponentially if you use tobacco. You are also more likely to experience an aneurysm, which can lead to death. Tobacco also has a tendency to invite heart disease back for another round after you've already had bypass surgery. Tobacco use is also an important risk factor for stroke. The drug produces several effects that damage the cerebrovascular system. Women who take oral contraceptives and use tobacco increase their risk of stroke many times.
Hold on a second, I have a question.
Oh, do you take oral contraceptives?
What? No, it isn't related to that. I just remembered that I smoke a pipe, which is for classy gentlemen. There's no way such an elegant instrument could give me any heart disease.
Actually, it can. I was just about to get to that part. But first, you should sit down. You're blocking the screen. Cigars, pipes, and even smokeless tobacco are not safer alternatives to cigarettes. People who use smokeless tobacco or smoke cigars or pipes also have a higher risk of cardiovascular disease and death than non-tobacco users. It is also important to avoid other people's smoke. The link between secondhand smoke, also called environmental tobacco smoke, and disease is well known, as unfair as it may seem. Each year, about 34,000 adults die from heart and blood vessel disease caused by other people's smoke. The risk of stroke for non-smokers who are exposed to secondhand smoke is increased by an estimated 20 to 30%. And keep in mind, this isn't even their fault. It's the fault of the people who are smoking around them.
Wait just a bloody minute. I already have heart disease. What good would it do me to quit the tobacco now?
Don't be discouraged. Here, observe this mummy. This mummy represents your organs that have been damaged by tobacco. Are you still alive, Mr. Mummy? Good. As long as you're still alive, your organs can begin to heal themselves as soon as you stop harming them with more tobacco, as you will see here. Heart disease can be prevented and controlled, but you must follow your treatment plan, and quitting tobacco is a big part. How do you feel now, Mr. 70s Mummy?
Funky fresh.
Hey, sit back down. You're blocking the 70s Mummy.
It's okay. I was on my way out. I decided I don't need this class. I already quit smoking.
Well, congratulations. Would you mind telling the class which method you used to help you quit?
Yeah, bro. I used this ingenious invention called dip. No smoke involved, no lung cancer, dude.
Okay, now you really need to sit back down. Smokeless tobacco is just as bad for you as smoked tobacco.
Yeah, man. Dip is so not hip.
Smoked and smokeless tobacco are linked to heart disease, stroke, and other chronic lung diseases. Both kinds of tobacco can also increase your risk for cancer of the bladder, throat and mouth, kidneys, cervix, and pancreas. If there's even a tiny glimmer of desire inside of you to quit tobacco, then the thought of losing your jaw, voice box, or other important body parts to cancer should be a good source of motivation. Here are some statistics of tobacco. Tobacco use is the most preventable cause of death in the United States, according to the American Heart Association. Almost 1/3 of deaths from coronary heart disease are attributable to tobacco use and secondhand smoke. Smoking is linked to about 90% of lung cancer cases in the United States. About 20% of adult men and about 16% of adult women use tobacco. The highest percentage of people who use tobacco are between the ages of 21 and 34. About 54% of American children ages 3 to 11 are exposed to secondhand smoke. On average, tobacco users die more than 10 years earlier than those who do not use tobacco. Millions of people successfully quit every year, so it's not impossible. What makes tobacco so toxic and dangerous? We asked Dr. Travis Berger, a scientist at the Center for Disease Control and Prevention, for his insight.
Actually, my friends call me T-Burger. There are more than 5,000 chemical components found in smoked and smokeless tobacco, and hundreds of them are harmful to human health.
For some examples, we asked Dr. Richard Aris, a scientist with a less annoying voice.
Hey!
Harmful to human health, eh? That's my area of expertise. Well, there's cadmium. It's a metal used to make batteries. I'm certain you don't want to insert any batteries into yourself unless you're some sort of cyber person. Cadmium and cadmium compounds can cause lung cancer and have been associated with kidney and prostate cancer. Chromium-6 is used to make alloy metals, paints, and dyes. Chromium-6 compounds cause lung cancer and have been associated with cancer of the nose and nasal sinuses. If you've ever dissected anything, then I'm certain you know about formaldehyde. There's a reason why you're not supposed to put it in your mouth. It causes leukemia and cancer in respiratory tissues. Polonium-210 is radioactive. That fact alone should convince you to stay bloody well away from it. Tar is another good example. It is a combination of multiple chemicals in tobacco smoke. It leaves a sticky brown residue on your lungs, teeth, and fingernails. Butadiene is a chemical used to make rubber. Research has indicated that it can cause certain blood cancers. Arsenic is used to preserve wood. Some compounds of this chemical have been linked to cancer of the lung, skin, liver, and bladder. Arsenic is also the name of a lady I dated for a couple months back in uni. I should probably give her a bell. Benzene is used to manufacture other chemicals. It can cause leukemia. Now, would you really be so daft as to put any of this guff in your body? And these toxic chemicals can be found in smoked and smokeless tobacco, right? That is correct. It's why I quit smoking back in '88. That and I wanted to preserve my singing voice. I just couldn't bear the thought of losing the ability to perform with my band. Nicotine is a dangerous and highly addictive chemical. It can cause an increase in blood pressure, heart rate, flow of blood to the heart, and a narrowing of the arteries. Nicotine may also contribute to the hardening of the arterial walls, which in turn may lead to a heart attack. This chemical can stay in your body for 6 to 8 hours, depending on how often you use tobacco. Also, as with most addictive substances, there are some side effects of withdrawal. Now, raise your hand if you've ever died from leaving a car running in a closed garage. Well, congratulations! You know what carbon monoxide is. Did you know that when you smoke, you inhale the very same substance that your car emits when it's running? Carbon monoxide is a harmful gas. Once in your lungs, it is transferred to your bloodstream. It then decreases the amount of oxygen carried in the red blood cells. It also increases the amount of cholesterol that is deposited into the inner lining of the arteries, which, over time, can cause the arteries to harden. This leads to heart disease, artery disease, and a strong possibility of heart attack. Smokers are not the only ones affected by tobacco smoke. Secondhand smoke is a serious health hazard for non-smokers, especially children. Non-smokers who have high blood pressure or high blood cholesterol have an even greater risk of developing heart diseases when they're exposed to secondhand smoke. Secondhand tobacco smoke contributes to about 34,000 premature heart disease deaths and 7,300 lung cancer deaths. Studies show that the risk of developing heart disease is about 25 to 30% higher among people exposed to environmental tobacco smoke at home or work. And keep in mind that, this wasn't their fault. It was the fault of the people around them. Secondhand smoke promotes illness too. Children of smokers have many more respiratory infections than do children of non-smokers. So if you're going to quit smoking, do it for your kids. This was excerpted and adapted by the American Heart Association from When Risk Factors Unite. Appearing in the Stroke Connection magazine, January and February 2005. The science update was May of 2008. Tobacco users have a higher risk of developing cardiovascular disease. Factors like high blood pressure can stretch out the arteries and cause scarring. Bad cholesterol, called LDL, often becomes lodged in the scar tissue and combines with white blood cells to form clots. The good cholesterol, called HDL, helps remove LDL from the arteries. Other problems caused by tobacco. Tobacco drains everybody of their favorite 80s action hero, HDL. Tobacco temporarily raises your blood pressure and heart rate. It also increases the likelihood of blood clotting. It also makes it more difficult to exercise. Ding! A stroke is more than just golf terminology. It is a potentially lethal event that affects your brain. Use of tobacco increases likelihood of blood clots, which can in turn cut off circulation to the brain. This is called a stroke. When your brain undergoes such a catastrophe, you may be unable to speak, walk, or do other things that were second nature to you before. You will become helpless, leaving it up to family members to interpret your gibberish speech and help you do basic things such as taking a bath. Though the knowledge you have gained thus far may be unsettling, remember that not all hope is lost. Whenever you find yourself in doubt that you will ever be your old self again after quitting, remember the 70s, mummy. Immediately after you quit, your lungs and other tobacco-damaged organs will begin to repair themselves. You can start getting better the day you put down the tobacco. You can start getting groovier, too. Your lungs function as the air exchange department in your body. They are made of tubes that branch out into small sacs called bronchioles and alveoli, where oxygen exchange takes place. Your body takes in the oxygen you breathe, and it uses it as fuel. When you breathe in, the sacs inflate. When you breathe out, the sacs deflate. In a healthy person, these tubes and sacs are very elastic and spongy. In a person with a chronic lung disease, these sacs lose the elasticity, and oxygen exchange is greatly impaired. Of course, your body cannot function properly without oxygen. The lungs protect themselves with a thin layer of mucus, and by moving toxic particles out with small hairs called cilia. Ooh, ah! In a smoker's lungs, the cilia move more slowly and struggle to remove harmful particles. You can't cough, sneeze, or swallow effectively to clear these toxins. They become trapped in your lungs, leading to a higher risk for numerous dangerous health problems, including heart disease, stroke, and cancer. Everybody enjoys having a cold, right? Well, if you want to have an especially intense cold for the rest of your life, then chronic obstructive pulmonary disease is your dream condition. It is a combination of emphysema and chronic bronchitis, which both make breathing as difficult as if the large jogging man from earlier were to trip on a pipe again and fall on top of your chest. Speaking of pipes, these conditions are directly related to smoking. Now that you know of the dangerous things tobacco can do, I, the narrator, and the information booklet that I'm using to make this presentation, want to congratulate you on your decision to quit. Such a bold decision will add years to your life and allow you to live up to your full physical and mental potential. Beware, though, that the path you have chosen will not be easy. However, it will be rewarding. You will be more likely to stay away from tobacco if you prepare for two important things. 1. The final time you use tobacco. You'll be kissing it goodbye. Just don't kiss it too hard. And 2. You will be attacked by urges to use the tobacco again once you have put it down. You must amass all of your willpower to resist the temptation. To make quitting as organized as possible, think of it as 3 steps. Step 1. Choose a date to quit within the next month. Step 2. Complete and sign a no tobacco contract in front of witnesses who will support you. Use the time wisely until your quit day. The third step is to acknowledge your options of how to quit. You can combine any multitude of them that you see fit. One option is to quit all at once. Pile all of your tobacco up in the backyard and set it on fire. Definitely try not to inhale the smoke. Another option is to gradually taper off. If you smoke, count the puffs from each cigarette. And it's okay to stomp it out before it's spent. If you dip, decrease the time that you leave it in your mouth. A third option is to see a doctor for some prescription medications and nicotine replacement therapy. It'll be your friend in your quest to quit.
Coming to the doctor? You should come and see me. Your friend T-Burger is well known for prescribing some good stuff.
Quiz time!
Don't be nervous. There are no wrong answers.
Who invited you, T-Burger? Question 1. How many times per day do you use tobacco? Just pick from the list below. Oh, and if you use it more than 25 times, feel free to tell us exactly how many times a day you use it if you keep track of that. We would really be interested to know. Second question. When you are homesick and stay in bed all day, do you still use tobacco? Do you just have some on the nightstand that you reach over and grab, even if you're stuck in bed all day? Third question. After you wake up in the morning, do you have your first tobacco use within 30 minutes? Pancakes and dip. Quiz time is done. It is now time to assess your answers. If you use tobacco more than 25 times per day, and you answered yes to questions 2 and 3, then it seems as though you are addicted to nicotine.
Darn it, I failed! My mom's gonna be so mad! There goes my shot at Clemson!
Anyway, nicotine replacement therapy such as gum or patches will be an efficient aid at helping you quit tobacco. There are also non-nicotine replacement medications that can ease your mind and lighten the blow of withdrawal symptoms. Beware of Wellbutrin and Chantix, though. The FDA has found that these medications can cause behavior changes such as depression, hostility, and agitation. It's not guaranteed that such side effects will happen, but you must be vigilant and realize that any sudden mood shifts may be because of the medication. If at any point your brain starts telling you to hurt yourself or others, you should stop the medication and call a medical expert immediately. Remember that your doctor is the man. Or if she's a woman, then she's the lady. Doesn't quite have the same ring to it, but I'm sure if we keep saying it, it'll have that same ring someday. Anyway, the point is that your doctor is an expert in the medical field. He or she can give you the best instructions and precautions about which medications to take to aid your tobacco cessation. No matter what kind of medication you take, it will be rendered worthless if you do not take it the correct way. For this reason, your doctor will be your hero in your quest to quit. We will study different kinds of nicotine replacement therapy in the next presentation, so
come on back for the next part.
T-Burger, get the heck out of here!
You can't kick me out. T-Burger is the lady.
All art and animation in this presentation was made by Justin Ian Miller. It was also narrated by Justin Ian Miller. That's me. Educational information was provided by the American Heart Association. That kind of rhymed. Well, see you guys in the next part. Your body takes in the oxygen you breathe and uses it as fuel. Let's do that again. I went fanboy there for a second. Oh, uses it as fuel, yeah!